October is Mental Health Awareness Month. It is very timely and relevant to conduct programs supporting the celebrations since we knew that COVID-19 pandemic negatively affected many people's mental health and created new barriers for people already suffering from mental illness. Payapa National High School welcomes you to this free webinar on mental health in line with the 2021 Mental Health Awareness Month with the theme Mental Health Care for All, Let's Make It a Reality. To formally begin our program, may I request everyone to please stand for the singing of the national anthem to be followed by a prayer through an audio-visual presentation.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, pero sa sinakalan, alam ng puso, sa dikit mo'y buhay. Upang hinirang, kuya ka ng magiting, sa mandulupin, di ka pasisingil, sa nanagang tutok sa simoy at sa langit mong pagaw, ay tinatang tulad, awit sa pagkayang minamahal, ang isang lang matawad mo'y tagumpay na naghihingi, ang bituin at araw niya kailan pang ay di magdidinig. Luman ang araw ng walhagin pagsinta, buhay langit sa piling ko. Ang hinigaya na pagkay magagi, ang mamatay ng dahil sa'yo.
Let us pray. Our loving and generous God, we praise and thank you for the bountiful blessings you have given us. Thank you for giving us a mind that can know and a heart that can love. Thank you for giving us the chance to continue learning amidst the pandemic that had caused a lot of changes in our lives. We are sorry for the times we have failed you. We humbly ask for your forgiveness. Father, help us stay focused on our studies. When learning becomes difficult, grant us the gifts of courage and enthusiasm. Grant us the grace to use our knowledge in making a difference into the lives of the people around us. All this we pray in your mighty name. Amen.
This time, let us hear an opening remarks from our very able and hard-working Principal 4, Dr. Julius A. Villavicencio.
Magandang araw po sa ating lahat. Unang-una sa ating mga dumadalong mga mag-aaral, kawani, mga magulang at stakeholders para sa ating activity na ito regarding sa ating mental health. Sa pangunguna ng ating guidance counselor, Ma'am Sheila Garcia, ay isasagawa natin ngayon ang napakahalagang gawain. Alam nyo mga kasama, mga bata, sa nangyayaring ito sa ating panahon, ganun din ang epekto o dulot ng mga pagbabago sa kapaligiran, ganun din ang epekto ng pandemic. May mga bagay na nagpapahirap hindi lamang sa physical nating katawan, maging sa pag-iisip o usapin ng mental ng ating mga kasamahan o ating mga kababayan. Hindi nga naman ibig sabihin kaya natin ito isinasagawa ay tayo ay nawawala na sa tamang realidad. Mahalaga ito upang lalo nating mapatibay ang ating tinatawag na mental health. Sabi nga nila, health will not be complete without mental health. So yan lamang ang aking pagbati sa inyong lahat. Gayon din na tayo ay manatiling kalmado, mag-ehersisyo at gawin natin ang relaxation para sa ating mental health. Magandang araw po muli at maraming salamat.
Thank you, Sir Julius, for the wonderful opening remarks. To introduce our speaker for today's symposium, let us hear it from Mrs. Maria Sheila M. Garcia, PNHS Guidance Counselor and Mental Health Advocate.
Mental health is not a destination, but a process. It's about how you drive, not where you're going. As part of the guidance program, Payapa National High School aims to promote and maintain a positive mental health among learners and its school personnel, especially in this time of pandemic. With this, we are providing series of activities and services for the benefit of our learners, especially this new normal education. For today's activity, let me introduce to you our resource speaker for our mental health awareness for this school year 2021-2022. She was born last May 14, 1988 and currently residing at Mataas na Bayan, San Pascual, Batangas. She is married to Mr. Jason T. Espinol and they were blessed with one beautiful child. She graduated her bachelor's degree at Lyceum of the Philippines University, Batangas, major in psychology, and eventually finished her master's and doctorate degree at the same school. She is a registered psychologist and a registered psychometrician at a very young age. She is also a certified mental health first provider, a researcher, and a writer. Currently, she is the head of the psychology department at University of Batangas. Learners, parents, viewers, ladies and gentlemen, let me introduce to you our resource speaker for today's event, Dr. Sharamay Tumambing Espinal.
Good day, everybody. I'm Dr. Sharamay Tumambing Espinol. I am a certified mental health first responder, a registered psychologist, and a registered psychometrician. I am also the program head of the psychology department at the University of Batangas. And for today, I'm going to talk about mental health, warning signs, and management approach. So I hope you would take the time to listen to what I'm going to discuss because this is a very important matter. Okay, before we begin, I want to know how you're feeling right now. If this is live, I'm going to ask you to participate in an online quiz. But since it's recorded, I just want you to reflect on the things that I'm going to ask. Okay, so here are some questions. Number one, how have you been feeling in the last week? In general, how do you feel? Second question is, what was your last thought like before going to bed last night? Is it something good? Is it something bad? Is it positive? Is it clouded? You can describe that on your own. And the next one is, what was your first thought? Okay, or what was the first thing you did after you opened your eyes this morning? What was the first thing you did and you thought about when you opened your eyes? Okay, now I want you to take note of those things as we move along because those are very important details. Okay, now one more reason. What motivated you to join this webinar? Mental health is a big topic these days. A lot of people are concerned about mental health. A lot of professionals, a lot of students are having these struggles and problems related to mental health. So I hope you are here to talk about this and to know more about mental health as well. Okay, we are going to talk about specifically these four things. Number one, what is mental health? It's just a basic definition. Number two, the integrative approach to understanding mental health. The third one would be the warning signs of poor mental health. And the last one is how do you take care of yourself? Okay, so let's go to the first one. What is mental health? Mental health is more than the absence of mental disorders, but a state of well-being to realize one's own potential or your self-image, to cope with the normal stresses of life that's related to your resiliency, and to work productively and fruitfully, to be productive and creative in your chosen careers or courses or educational endeavors, and to be able to make contributions to the community. This definition is based on the Department of Health and the World Health Organization. Now, mental health refers to well-being in different aspects. First, in your emotions. If you recall your answer to the questions that I have given earlier, How were you feeling this morning? What was your general mood in the past week? So, emotions pertain to feeling happy or being contented if you have high mental health or good mental health. The next one, behaviors. Okay, are you being productive? Were you able to submit all your assignments? Were you able to accomplish your module? Were you able to help out at home? And the last one, your thoughts. How are your thoughts? What was your first thought in the morning and your last thought the night before? Are they positive? Are you thinking about the future? Are you planning ahead and those things? Okay? Now, mental illness is the third most common disability in the Philippines. This is from the study of Martinez and colleagues in 2020. So this is very recent. Okay? When you say disability, it leads you or prevents you from functioning properly. So we have physical disabilities like yung mga putulang kamay, putulang paa, walang daliri, bulag, bingi. Those are disabilities or disabled. Ang ibig sabihin lang nito, mental health disables you. It prevents you from functioning properly. And here in the Philippines is the third most common disability. Okay? So we are disabled when we have mental illnesses because we cannot function at our fullest potentials. It prevents us from addressing important matters in our lives, from helping other people, and from taking care of even our own selves. That's why it becomes a disability. Now, let's take a look at the integrative approach to understanding mental health or the biopsychosocial model. The biopsychosocial model states that mental health or health and illness are determined by a dynamic interaction between your biological, psychological, and social factors. So let's take a look at each one. First is your social factors. It pertains to your family, culture, tradition, community, discrimination, and poverty. Okay? Ang sabi sa biopsychosocial model, the development or occurrence of a mental illness and psychological disorder is powered by the combination of these three things. Commonly, social factors serve as triggers if you already have a biological predisposition. Kung nasa genes mo yung disorder, social and psychological factors will serve as triggers for the manifestation of the symptoms. Pero pwede rin naman na yung mental health problem mo is primarily caused or fueled by social factors. If, for example, you are part of a family who expects too much from you, who expects a lot, who forces you to do things that you don't like, such as, they choose the course or program that you're going to take in college. They force you to become, for example, a nurse, even if you want to be an engineer. Okay, so the pressure that comes with that, it could lead to mental illness. Culture and tradition, the people around you, how they deal with you or how they interact with you, it adds to the possibility of acquiring a mental illness. Okay, if your culture, say for example, is very traditional or very strict, okay, that's one. And also discrimination, poverty, those important factors. It's true that money is a very important aspect in our lives. It doesn't make the world go round, or it doesn't really buy us happiness and all of that, but having access to financial resources allows us to have a better life. Okay, in reality, access to mental health facilities and mental health services is very expensive. Okay, like for example, if you go for counseling, or if you want to have an assessment in mental health clinics, they could charge you of 2,500 pesos. Okay, if you go to a doctor right now, a medical doctor, and you want to have a checkup, the fee is around 400 to 800 pesos per checkup. Kung may specialization such as neurologist or internist or something, your first checkup could be 1,000 pesos. But if you go to a psychological clinic, or if you go to a psychiatrist and then you will undergo assessment and all of that, you could pay as much as 2,500 pesos just for an initial assessment. If you need a battery of tests, it would cost more. Okay? So, having resources would lessen the probability that you will develop psychological disorders. And also, the state of poverty contributes to a lot of mental illnesses. Kasi it's a picture of your socioeconomic status. If you're living in poverty, it also means you're living in a poor community. Magulo, maingay, madaming sakit, and all of those things. Okay, it's correlated. If you have low socioeconomic status, it also means you're living in a less organized system. Okay, and if, for example, you have a specific condition, you would be prone to discrimination. Being members of the LGBTQIA community, for example, it increases the risk of experiencing discrimination. If you have disabilities or disorders, it also poses a lot of possibilities for being discriminated. And if you are a woman, okay, if you're a girl or a female, you're more susceptible to experience discrimination and therefore more susceptible to some forms of psychological conditions such as anxiety and depression. Okay, and anxiety and depression are among the most common conditions that we have in society today. The second factor is biological factors. This includes your genes, hormones, injuries or physical injuries that you have encountered, the use of drugs, and having comorbid diseases. So for this, sabi natin, if you have the biological predisposition for a specific disorder, it means that the disorder or mental state or mental disability runs in the family and you have it in your genes. So if someone in your family has a psychological or mental illness, it means you may also have that. Okay, given that it's genetic, okay, kung sa genes siya naiipasa, just like schizophrenia, okay, it's highly genetic, you're at a higher probability of also having the same disorder. Now, as when it comes to hormones, hormones are the chemicals in your body. Okay, inside the brain, we call them neurotransmitters, but in the body, we call them hormones. The level of hormones in your body can contribute to a lot of illnesses and psychological disorders or mental disabilities. For example, all of us, male and female, we all have the male and female hormones. Okay, so we have females have what we call testosterone. Males, they also have progesterone and estrogen. The difference is on the amount or the level. Males, they have higher levels of testosterone. That's why they are more aggressive and they are more of, a risk taker type compared to females. Females are highly emotional because of the presence of higher levels of progesterone and estrogen compared to men. Okay, now, if the levels are not correct, like if you have higher levels of testosterone, higher than normal, it could lead you to engage in more risky behavior. Okay? Suicidality, for example, can be traced on the level of testosterone. It's related because if you love to take risks, if you're willing to take risks, it could also mean that you're more prone to risk your life just to solve all your problems. Okay, now as for injury, if you have or if you've experienced any type of injury that could hurt your body or your brain, it could lead to psychological disorders or mental illnesses. A blow on the head or a damage on any part of your brain can lead to psychological conditions. Use of drugs and other substances also lead to mental illnesses because these drugs alter your system. Okay, if a lot of students, a lot of adolescents are prone to engaging in the use of prohibited drugs or experimental substances or experimental drugs because of peer pressure. But let me explain this to you in a nutshell. The chemicals that those drugs have, the body can also produce them. Most of them are produced by the body. Now, if you take the drugs, okay, so the chemicals are already there, at first magkakaroon ng excess. Magkakaroon ng excess chemicals in your body. The body will then realize na hindi na niya kailangang mag-produce ng chemicals na yon kasi nasusupply naman ng drugs. Therefore, magre-rely ang katawan mo for those chemicals and the drugs that you're taking. That's why you get addicted to them. And then later on, especially since a lot of these drugs are giving you temporary relief or temporary positive experiences, you will look for them. You get hooked. And then matotolerate na ng katawan mo yung amount ng substance na tinetake mo, so you would want more. Okay, and of course, these drugs are not natural. Okay, they have been produced in laboratories. They have been mixed with different chemicals, so they have side effects. Even if you're taking regular medication that's prescribed by the doctor would always tell you you only have to take the drugs as prescribed. Lagi yan nakalagay. Kasi all of these chemicals could have a negative side effect on your body. And it also happens when you use prohibited drugs. Now, later on, a lot of people, actually, a lot of artists who have died, if you're watching the news or the television, you would know that most of the artists who died because of drugs did so because of overdose. They took a lot of it because they can't bear the feeling of not being intoxicated. Pag sinabi nating intoxicated ka, ibig sabihin nun, you're under the influence of a specific drug or alcohol. Okay? Now, of course, diseases that are comorbid with psychological conditions or mental disorders also exist, such as people who have cancer are more prone to experiencing depression and anxiety because they know that it's a terminal disease and they could die anytime. Okay, so if you have these conditions, it could increase the probability of having mental disabilities or mental conditions. Another example is women who have polycystic ovarian syndrome. Okay, if you're not familiar, polycystic ovarian syndrome is a condition wherein the female has an irregular menstrual period because of the presence of the irregularity in the production or maturation of the egg cells because there are cysts inside the ovaries. Okay, so some of the side effects include, of course, irregular menses, or it could be increased amount of blood during the menstrual period. It could also lead to weight gain even if you're not eating that much. So this condition is very frustrating for a lot of women. And when you're in the marrying age, it could lead to problems when it comes to fertility and conception or childbearing. So it's very important that we understand that this could lead to mental health problems. The last one is psychological factors. It includes your beliefs, emotional quotient, coping mechanisms, IQ, resilience, and cognitive biases. Cognitive biases pertain to how do you interpret the things that are happening around you. Okay, some people are very pessimistic. They tend to always think or focus on the negative things. That's why when something bad happens, instead of finding humor in the situation, some people would attribute it to other people or would interpret it into something that's very catastrophic. That's why it could to lead to the development of more anxiety. Okay, as for beliefs, this is greatly affected also by the way you interpret the world around you. Your emotional quotient and coping mechanisms pertain to how do you deal and manage your emotions. Okay, if you have a problem, what do you normally do? Can you identify your specific emotions? Kasi that's part of emotional quotient. If, for example, you're feeling frustrated, sometimes your frustration could make it look like you're feeling angry, but you're not really angry, you're just frustrated. Sometimes you can also mistook anger and jealousy. Okay? Sometimes jealous ka pero akala mo angry ka. What's the problem with not being able to identify your emotions? The problem is you won't be able to deal with them accordingly or properly. Kasi kung hindi mo alam kung ano yung i-address mo, paano mo siya masosolve talaga? But in the scientific process, the first step is always to identify the problem. Now, if you cannot identify your emotions, you would not be able to know how to manage them or how to express them properly. In coping mechanisms, we have healthy and unhealthy coping mechanisms. Now, coping mechanisms pertain to how do you cope or how do you deal with your problems. When you're presented with a difficult situation, what do you normally do? Examples of healthy coping mechanisms is focusing on the problem, taking a break, uh, engaging in relaxation techniques such as breathing exercises, and asking for help. Okay? Examples of non-healthy or dangerous coping mechanisms include engaging or taking in substances to forget about your problem, or trying to solve it on your own, or being detached from other people. Okay? Now, IQ is highly related to your cognitive biases. People who have higher levels of IQ, of course, or general knowledge, can have the ability to know how to solve their problems compared to other people who have lower IQ. Okay? So, these three, when you combine these three together, it will allow you to have a better understanding of why a mental illness or a psychological problem exists. Okay? Because sometimes you will wonder why things happen for different reasons. Okay? Depression could also be traced in these three factors. Okay? Example, if a person comes from a family wherein there's a presence of cancer. Okay, cancer is genetic. Okay, so there are family members who have died from cancer and who already have cancer and are manifesting symptoms. Now, that person, meron siyang biological factor. Now, the social factor could be because of the previous cases of cancer in the family. They are now faced with poverty or living in poverty. They lost a lot of their financial resources in trying to, provide medical care for family members with cancer. Okay, so that's the social factor. We could also include, say, for example, how the family treats each other. There's a lot of pressure, there's a lot of sadness in the family because of the previous cases of cancer. Okay? Now, psychological factors. Your belief system. If, you have already surrendered and you know na, alam mo na, you don't want to live your life anymore because you know that there are already 4 or 5 people in your family who have had cancer and you're so sure already that you're going to have cancer. So, yun na yung belief mo, yun na yung belief system mo. So, ayaw mo nang gumawa ng plans, ayaw mo nang mag-isip ng mga gandang bagay because you're so sure na may cancer ka din. Okay? So, you just wallow in that kind of sadness. And those three, when you combine those three together, it could lead to depression. Okay? Now, why is it important to understand the biopsychosocial perspective or biopsychosocial model? Because it will allow you to understand how to address the mental illness. Okay? If the mental illness is something that's highly biological, genetic siya, the best course of treatment would be to go to a psychiatrist because the psychiatrist can provide prescription for drugs. Okay? Before you seek for psychotherapy or psychological treatment. Okay? If it's biological, it would be helpful to seek the help of a general physician because there could be other comorbidities or other existing conditions na kailangan mo nang ma-address before treatment. Now, if it's social, you can decide on whether you would stay in that kind of environment or leave. For drug addiction, example natin, mataas ang rate ng relapse for drug addiction. So, what happens is if a person is addicted to drugs, so magpaparehab siya. Okay, once the person is already clean, lalabas siya ng rehabilitation center. If that person will go back to the same kind of environment kung saan siya nanggaling, mas mataas yung possibility na siya ay maka-experience ulit na mag-drugs or magkaroon ng relapse. Kasi yung mga binibilhan niya ng drugs, nandun pa din. Okay? So you need to see all this or consider all these perspectives in trying to understand mental conditions. Next, what are the warning signs of poor mental health? How are you going to identify, or how can you say that you or the people around you are experiencing problems in their mental health? This is another statistics. Mental illnesses begins by the age of 24. Okay? 75% of the time. Now, 50% of the time, they start to manifest at the age of 14 years old. So that's why teenagers or adolescents are so prone to experience a lot of mental health problems. Biopsychosocially speaking, it could be attributed to the fact that there are a lot of changes in your life during your adolescent years. The activation of your secondary sex characteristics is one. Okay? It's confusing. There's a lot of adjustments. And your role in the society is difficult to establish. Kasi hindi mo alam, ikaw ba'y bata pa or matanda na. You're somewhere in between. Sometimes your parents would tell you, you're old enough to clean the house, but you're too young to go out with your friends. So you get confused about, your identity. Sino ba talaga ako? Do I have the rights, all the rights of an adult, or do I follow the rules and regulations set forth for kids? So it's a very confusing time in your life. Now, here are some warning signs. These are not symptoms of specific psychological disorders, and I highly discourage you or prevent you from diagnosing yourself. These are just indicators that a person or you may have a problem related to your mental health. Okay, the first one, sleep or appetite changes. When there's dramatic sleep and appetite changes or decline in personal care, this is an indication. Okay? Some people sleep very well. Okay? Some people don't. The amount of sleep that you need requires on the need of your body. For adolescents, it's normal to sleep longer than adults do because you are under a stage of development that is very rapid. However, if it's not normal or if it is a sudden change, then that is an indicator. Kung halimbawa, ang normal amount of sleep mo as an adolescent is 6 hours a day or 10 hours a day and it declines. Kung 10 hours a day siya, tapos ngayon 4 na lang. Okay? What leads to the sleepless nights? Are you overthinking? Are you worrying too much? Okay, that's why it's an indication that there's a problem. Or some people who are depressed or who have problems cope by sleeping a lot. Now, if the person is sleeping a lot or sleeping for extended periods of time, you need to check if the amount of sleep is restorative. If people spend a lot of time sleeping pero pagod pa rin sila or non-restorative yung sleep, it's an indication. Kasi pwedeng mababaw yung tulog niya, kaya hindi naman niya nakukuha yung rest na kailangan niya. Kaya hinahabaan niya yung tulog niya. Okay? Next one, mood changes. If there are rapid or dramatic shifts in emotions or depressed feelings, it's an indication. Okay? We have what we call bipolar disorder. Bipolar disorder is characterized by the presence of major depression and mania or hypomania. Okay? So if there's a sudden shift in your emotions, for 2 weeks you're feeling down, and then the following week you're feeling, some kind of increased competence, or you feel like you're risky and adventurous suddenly after 2 weeks of feeling down, it's an indication. Okay, your mood is changing rapidly without any cause. Third is withdrawal or recent social withdrawal and loss of interest in activities that you previously enjoyed. This is also called anhedonia or loss of interest in life. If your favorite thing to do is to watch movies and then you're no longer interested in doing that, that indicates that there's a problem. If you love going out and talking to your friends and then you suddenly don't want to, that's another indication. Drop in functioning or an unusual drop in functioning at school, work or social activities, such as when you quit a special club wherein you're a part of, when you start failing in class. A lot of my students are manifesting these kinds of problems every now and then because of the current situation, the pandemic. In college, we're doing it blended or online. Uh, I meet my students once a week and we have this session. Sometimes they won't open their cameras because they're really not interested. Even my good students, my students who excel in class before when it was face to face, now they're changing. Okay, somehow they're not ready for recitation anymore. They don't want to answer, they don't submit their assignments on time, so that's an indication that they are troubled. Okay, next one is if you're also performing poorly when it comes to social settings, if you no longer want to participate in family conversations. Next is problems in thinking. Problems with concentration, memory or logic, thought and speech that are hard to explain. You did not have an accident, you did not bump your head, but suddenly it's just more difficult for you to perform cognitive tasks. Just like my students, they can no longer finish tasks. One student was actually asking why before, when we had our face-to-face classes, they can finish studying 5 different subjects in a day. Okay, and they could finish all their requirements on time. Right now they have a lot of time since we don't have classes every day, we just have it once a week. The rest of the week they can do all their coursework, and yet they could not find the time to finish it because they cannot concentrate. There are a lot of thoughts that are running in their minds, at yung thoughts na yon minsan ay negative. Next, when there's increased sensitivity, this could be sensory or emotional. Okay, if you suddenly don't want to get up in the morning because you find na masyadong maliwanag ang araw, nakakairita, pero dati naman hindi ganun yung perspective mo, or nai-irritate ka kapag maingay, kapag may mga batang maingay na naglalaro, pero dati naman you enjoy being with kids. So you're becoming sensitive about these things. Next is apathy or loss of initiative or desire to participate in any activity. Kanina, yung anhedonia is you lack pleasure. Okay? You don't find the things that you loved before as pleasurable. In apathy, you don't care. Wala ka nang pakialam sa mga nangyayari sa paligid mo. Next is feeling disconnected. This is the same as withdrawal. Okay? You feel like you cannot relate to the things that are happening around you. It's like you're watching everyone and everything that is happening around you, pero hindi ka na makasali. Even if you try, you don't feel like you're there. You don't feel like you're that person anymore. Okay? Before, if you like to join the family while eating dinner and you tell stories to each other, now you're just there. You feel like an empty shell. They're talking about how their days went and all, and you're just sitting there and you don't want to participate anymore. So you're disconnected. Next is illogical thinking. When we say illogical thinking, hindi ka na rational mag-isip. Sometimes your thoughts are exaggerated. Sometimes you're being paranoid. Or sometimes hindi na rational yung mga iniisip mo. Like you're blaming yourself too much for the things that are happening, or you're blaming other people na hindi mo naman dapat i-blame. Next is nervousness. When there is fear or suspiciousness of others or a strong nervous feeling, it's also an indication that there is a problem. This is not just due to caffeine, okay? When you have high levels of anxiety, you also feel nervous most of the time. And it's normal, anxiety these days, it's normal, but I'm not saying that it's good or that it's not something you should worry about. Talagang nakaka-nervyos or nakakataas ng level ng anxiety ang pandemic because you don't know what could happen next. You could be asymptomatic, you could be symptomatic. Okay? It's normal to feel that dahil talaga namang nakakatakot. Pero, hindi rin tayo dapat makampante kasi yung normal feelings of anxiety mo, pag hindi mo siya na-manage or hindi mo siya na-solve, pwede siyang maging malala in the future. Okay? And then we have unusual behavior. When it comes to unusual behavior, it says here when there are odd, uncharacteristic, or peculiar behaviors, such as we call them compulsions, because you worry too much or are thinking too much. One way that people can relieve themselves from thinking too much is if they engage in compulsions like hair pulling. Okay? Some people, when they're stressed, gusto nila nagbubunot ng buhok sa ulo because it relieves them. Nakaka-massage ng scalp, so nakakaalis ng sakit ng ulo, nakakabawas ng tension. Pero it could be problematic kasi baka hindi mo namamalayan, kakaroon na pala ng bald patches in your hair because of that. Or some people or some teenagers engage in what we call non-suicidal self-injury. Non-suicidal self-injury is a condition wherein you hurt yourself physically to ignore the emotional pain or the emotional suffering. So this is also unhealthy and odd. Now, additional statistics, 3.6 million Filipinos have mental health issues. And we are talking here about the documented cases, those that are diagnosed. Hindi pa kasama dito yung mga ayaw magpagamot, ayaw magpa-check up, ayaw magpa-consult. And it's already 3.6 million. In that 3.6 million, 1.14 are diagnosed with depression. Around 847,000 have alcohol use disorders and around 520,000 are suffering from bipolar disorder. And this is a recent report just in 2021. And another sad thing is a huge part of this population ay adolescents. Okay. Now, since we have a lot of problems related to mental health, let's talk about how do you take care of yourself. Take care of your body. Okay? Your mental health is just as important as your physical health. And for you to feel good, it needs to start physically in your body. You have to feel good about it. How do you do that? Here are some tips. Eat healthy, fruits, vegetables, and in the right portions. Okay? Drink plenty of water, because water is the universal solvent. It helps you get rid of the toxins that are inside your body. When you drink plenty of water, you sweat, you defecate or pumupupo ka, and you also urinate, umiihi ka. So that process gets rid of the toxins in your body. And it's also good for the skin, okay? And for all the other major organs in your body. Next is you need to exercise. Exercise makes us feel good because any physical activity leads to the production of your happy hormones. And also, you prevent yourself from acquiring diseases that could lead you to experience psychological disorders if you're eating healthy, drinking a lot of water, and exercising. Next one is get enough sleep. I could never stress this more. Okay? Kaya lang, this is the problem of a lot of teenagers nowadays. They're not getting enough sleep. When I say enough sleep for teenagers, it's 8 hours or more. Okay? The main problem, of course, would be your cell phones and your gadgets and your Korean TV series. But you need to remember that in order to function properly, your brain should be refreshed. It has to rest every night for a specific number of hours. And, of course, avoid vices. Alcohol and cigarettes and other prohibited drugs should be avoided because they're not good for the body. Next one, love yourself. Okay, this is also very important. You need to value yourself, give time for the things that you love to do, think of what makes you happy, and do not feel guilty for the following things. When you say value yourself, prioritize yourself from time to time. I always love to say this, that you cannot pour from an empty cup. If you want to help other people, you need to help yourself first. If you want other people to respect you, you need to show them that you respect yourself. And if you want to receive love from other people, you need to love yourself first. Because if other people are observing you and seeing you na hindi mo naman mahal ang sarili mo or pinababayaan mo lang ang sarili mo, how can you expect them to give you genuine love? Okay? Now, I'm also saying you have to make sure that you love yourself first, but not too much. Okay? Just take care of yourself and remember to always allot love for yourself. Leave something behind for yourself. Okay? Do the things that make you happy. From time to time, allow yourself to enjoy life, because when you reach old age and you're not able to do the things that you love to do anymore, you will regret it. Okay? If you're working too hard in order to support your family because you're the eldest, every payday, even if it's just a small thing, you need to treat yourself. Do not feel guilty for saying no. We cannot please everybody. It's okay to say no. Making your own choices. Okay? Because eventually, as an adult, you will learn how to do this and you will be left to do this on your own. So, as early as now, make them. Pampering yourself, of course, it's part of self-love. If for females, just a good quality of hair conditioner, it would do you a lot of good. Taking your time while you're in the shower, that's a part of pampering yourself. You don't need to go to the salon or have a manicure for you to pamper yourself. Just being able to have the luxury of the time to spend the longer periods in the shower, it's good for a lot of women. Pulling your feet up at the end of the day when you've been working too hard, okay, or sleeping early, that's part of pampering yourself. Being unaware of something, you don't have to be sorry for being unaware of something, because we don't know everything and we are not perfect. That's not an excuse, but you should also not be sorry for that. Okay? And letting go. Don't be sorry or don't feel guilty about letting go. Because if something makes you feel bad or something is not consistent with yourself and you feel like it's harming you, you need to let it go. Things or people, it's just the same. If it's not good for you, you have to let it go. Next one, surround yourself with good people. Kaya nga sabi natin, if that person is not good for you, then let that person go. You need to find your people or your person. People who could understand you. People who genuinely care about you. Okay? Value quality rather than quantity. You don't need a lot of friends. You just need a few ones who you are sure would show up when you need them. Do not hesitate to reach out to others. If you need help, okay, it's not a form of weakness to ask for help. It simply means that you are being honest and that you know your limitations. And show up. Okay? If you want other people to show up for you, you need to show up for them. If it's also the same as social courtesy in a way. When you invite someone and you expect them to show up, make sure you also show up when they invite you. Okay? It's the simple give and take process in the social relationship. Next is find purpose in life. Know your worth by finding purpose in life. Know why you are here. If you don't know yet, then create a purpose for being here. Volunteer your time, volunteer your energy, and give back to the community. If you can volunteer into other social activities such as cleanup drives or run for a cause or things like that, or simply helping your family out, helping your parents, helping your siblings, taking care of your family, that could be your purpose in life. Cope with stress. How do you cope with stress? Avoid stress by rearranging your environment. If you cannot avoid it, then rearrange the entire environment just to be able to avoid stress. You can change schools, or you can avoid going at the same place with the same person if that person is stressing you out. Alter or change your situation, not just the environment. Change your course if you like. Accept things as they are and adapt by changing. If you cannot change the environment or the situation, sometimes maybe you can also change yourself in order to adapt to the situation. You need to accept that sometimes a cigar is just a cigar. Okay, a thing is just a thing. It won't change. A rock is a rock. But you can change your perspective by changing yourself. So that's how you cope with stress. Next is improve your state of mind. This pertains to mindfulness. Cultivate awareness of your thoughts and emotions. Practice. That's why sometimes yung direction ng ating psyche, hindi pwedeng towards other people lang. Kailangan towards ourselves din. Which means you need to understand yourself first. Be in tune of yourself internally. Ano ba yung thoughts and emotions mo? Kailangan mong maintindihan kung paano ka mag-isip at kung ano yung emotions na meron ka. Cultivate acceptance. Acknowledge that there are negative things about you. Kapag sinabi sa'yo, for example, na madamot ka, you need to reflect on that. Madamot ba talaga ako? Okay? You need to reflect on that. And if it's true, you need to accept it before you can change it. Hindi pwedeng hindi mo tatanggapin, tapos hindi mo babaguhin. Kailangan tatanggapin mo muna bago mo siya baguhin. Okay? Next, set realistic goals. In order for you to be inspired or be motivated, you need to have goals in life. Make sure that your goals are specific. Alam mo kung paano mo siya marireach. Use a time frame. Gaano katagal yung target mo bago mo siya ma-reach. Aim high but not too high. Kasi pag taas ng expectations mo, pag nalaglag ka or nag-fail ka, pagsakit din. Pero hindi naman pwedeng masyadong mababa ang expectations mo kasi hindi ka mag-grow. So make sure it's higher so that it will challenge you but it's not too high that it will frustrate you. Okay? Make a plan and a contingency plan. Planning allows you to have a direction in life. Just make sure that your plan is flexible or that you have alternatives so that, if you fail, you have a backup. Be accountable and responsible. Own it. If you do something good, own it. Kung sabihin nilang, ang galing-galing mo naman, sabihin mo na lang, thank you. Huwag mo sasabihin, ay, hindi naman po. Okay? If people are acknowledging your gifts, just say thank you. Acknowledge it. Be accountable for it. And be responsible for your decisions and your flaws or your faults. Be creative. Don't put yourself in a very small box or don't limit your potentials. Try out new things. This pandemic has given us a lot of opportunities to try new things. Like, if you're tired of just, lying in bed all day and scrolling on your cell phone, maybe it's time that you try something new. That's why a lot of people nowadays love cooking or planting, things like that, because they did not settle. They explored. They used their creativity to try new things. And it excites them and motivates them every day. Okay? Do things differently. Sabi natin, if it's not working, replace it. If something that if you're doing something and it's not working, you need to replace it. Okay. For example, if you've been trying to train your dog by using treats and it's not effective, try new ways of conditioning your dog. Or maybe try changing your treats. Baka hindi niya gusto ang lasa kaya hindi siya sumusunod. Test your skills and abilities. Do not be afraid to try something new. Explore, okay? And challenge yourself so that you can create something. Idle time is very important. Idle time is a time wherein wala kang ginagawa. When you're always busy, when you're doing a lot of things, it could be problematic because wala kang time na mag-isip. Wala kang time na mag-isip kung ano pang pwede mong gawin. Kung meron kang time na wala kang ginagawa, it could lead to exploration of possibilities. Okay? Kasi kung palagi kang may ginagawa, ang magiging focus mo, yun na rin lang ng yun. Wala nang bago. Okay? Next, the last one is to know when and get help. Okay, according to our lecture here, if you're not aware, we have the Mental Health Act, or RA 11036. This pertains to the comprehensive and integrated mental health services that are available in the Philippines. We have guidance counselors at your school. I'm sure you have one. If the guidance counselors are not able to help you because you have a bigger problem, not confined under counseling, you can also go to psychologists, psychiatrists, and mental health professionals. They will be able to help you. Okay, and these people, some of them can offer their services for free sometimes, and some of them are volunteers. We also have mental health first responders. If you're experiencing higher level of stress, they could respond appropriately. Okay, so that's it. I hope that you were able to learn a lot of things in this lecture. And if you have any problems or if you have any questions or clarifications, I will be happy to address them. Thank you and have a good day.
Thank you so much, Dr. Sharamay T. Espinal, from that very comprehensive discussion. Indeed, self love and compassion are key for mental health and well being, keeping depression and anxiety at bay. At this juncture, let us have Ms. Julian May C. Pilak, our health coordinator and a mental health advocate, for the awarding of the certificate.
To award the Certificate of Appreciation, let me read the citation. Republic of the Philippines, Department of Education, Region 4A Calabarzon, Schools Division of Batangas, Payapa National High School, Payapa Ilaya, Lemery, Batangas. Certificate of Appreciation is hereby awarded to Dr. Sharamay T. Espinol for sharing her valuable knowledge as a resource speaker during the Mental Health Symposium as part of the celebration of Mental Health Week with the theme Mental Health Care for All, Let's Make It a Reality. Given this 13th day of October 2021 at Payapa National High School, Payapa Ilaya, Lemery, Batangas. Signed, Dr. Julius A. Villavicencio, Principal 4.
Thank you, Ma'am Julian. This time, let us have Mrs. Elena P. Di Castro, Head Teacher 3 of MAPE Department, District Health Coordinator, and a mental health advocate for her closing remarks.
The COVID-19 pandemic has added a new dimension to concerns regarding mental health in our communities. Across the globe, stories continue to emerge of people's experiences of anxiety, fear, and depression due to the uncertainty and stress brought on by the virus. Job losses, financial and housing insecurity, the challenges of working from home, homeschooling, restricted access to health and social care services, and social isolation coupled with reduced support and contact with family and friends have all impacted people's well-being. And so, Payapa National High School came up on holding this kind of symposium to help both learners and parents to cope up with different mental issues brought by COVID-19 pandemic. On behalf of Payapa National High School teaching and non-teaching staff, spearheaded by our very able Principal 4, Dr. Julius A. Villavicencio, I would like to extend our deepest gratitude to the learners, parents, and to everyone who's been with us today, most especially to our keynote speaker, Dr. Sharamay T. Espinol, our guidance counselor, Ma'am Sheila Garcia, for sharing your knowledge on mental health, warning signs, and management approach, which is a great help on achieving better mental health outcomes. Thank you very much. So, let me end this with quotation. Your mental health is a priority. Your happiness is an essential. Your self-care is a necessity. Once again, thank you. God bless us all. Keep safe.
Thank you so much, Ma'am Ellen. And that ends our symposium. May all the learnings from today's virtual symposium helps you in achieving better mental health outcomes. So, this has been Mrs. Crystal Marjorie B. Galicanao, your program facilitator. Again, good day and God bless us all.